Breathing difficulties in cats are far more common than most pet owners realize. In fact, veterinary emergency clinics report that respiratory distress is one of the top reasons cats are rushed in for urgent care. But here's the problem. Cats are incredibly skilled at hiding pain. It's a survival instinct, and it means that by the time the signs become obvious, the situation may already be critical. That's why it's crucial to recognize even the subtle signs of trouble early on. In this video, we're going to show you exactly what those early warning signs look like and what to do if you see it. Signs of difficulty breathing in a cat. Cats usually breathe quietly, taking about 15 to 30 breaths per minute when they're resting, and the best time to check is when they're asleep. If your cat's breathing is more than 30 times per minute while at rest, and this continues for over an hour, that could be a red flag, especially if they seem lethargic or off in any way. One of the biggest signs of breathing trouble, called dyspnea, is when a cat adopts the orthopneic position. This means they'll stretch their neck forward and extend their front legs to open up their chest and make breathing easier. If you notice this, it's an emergency and you should seek immediate veterinary help. Other signs to watch for include a strange heart rate, pale or bluish gums, heavy belly movements with each breath, or flaring nostrils. Cats don't typically cough like dogs, so if your cat starts coughing, it's definitely something to be concerned about. You may also see more subtle signs, like them suddenly being unable to play or exercise the way they normally do. This can indicate a breathing issue. Flat-faced breeds like Persians are more vulnerable, so they require extra attention. That said, not all fast breathing is a problem. Cats might pant briefly after playing hard or during stress, and if it stops quickly and they return to normal, it's usually fine. But if you're at all concerned, call your vet and describe what you're seeing. If you found this information helpful for your cat's health, don't forget to hit the like button. Now, let's look at the reasons why cats breathe heavily. One of the most common reasons is upper airway disease, which affects the area from the nose to the trachea. Things like upper respiratory infections, nasal polyps, trauma, or tumors can block or irritate the airways, making it hard for your cat to breathe. Even something as small as a blade of grass stuck in their nose can cause big problems. In some cases, external pressure from an enlarged heart or a nearby mass can compress the trachea, making breathing even harder. If your cat is breathing noisily, has nasal discharge, or is breathing through their mouth, the issue might be in the upper airways. Next, lower airway disease could also be the cause. This includes conditions like bronchitis, infections like mycoplasma, or parasites like lungworms, which narrow the airways and make breathing more difficult. You might notice your cat wheezing, coughing, or breathing quickly and shallowly. As airflow becomes restricted, oxygen levels drop, and your cat has to work harder to breathe. In some cases, the problem goes deeper, affecting the lung tissue itself. Diseases like pneumonia, lung cancer, fluid buildup from heart disease, or bleeding from trauma can damage the lungs and make them less effective. Even secondhand smoke or blood clots can harm the lungs. A rare but serious condition called lung lobe torsion can twist lung tissue, cutting off airflow. If your cat is breathing rapidly, refuses to lie down, or has bluish gums, it's an emergency. Sometimes the problem isn't with the lungs, but the pleural space around them. Conditions like pneumothorax, where air leaks into this area, can prevent the lungs from fully expanding, leading to labored or shallow breathing. Another potential issue is with the thoracic wall, the chest muscles and bones. Trauma, like a broken rib or an open chest wound, can interfere with how the chest moves, making breathing painful and difficult. The diaphragm, the muscle that separates the chest from the abdomen, is also crucial for breathing. If it's weakened by trauma, hernias, or tumors, it can't help with breathing as it should. Sometimes, abdominal organs can push up into the chest, taking up space the lungs need. Cats with diaphragm problems might show signs like belly effort when they breathe, and this condition can worsen quickly. Finally, even something in the abdomen can affect breathing. If a tumor, fluid buildup, pregnancy, or severe constipation is large enough, it can push on the diaphragm and reduce the space for the lungs. This pressure makes it harder for the cat to breathe. Signs like a bloated belly, loss of appetite, or reduced energy could mean the problem is in the abdomen rather than the lungs. Now, let's talk about treatment. When it comes to treating a cat that's breathing heavily, everything starts with understanding the root cause. Whether the issue lies in the lungs, airways, or elsewhere in the body, treatment always depends on where the problem originates. But no matter the cause, one of the most urgent and immediate steps is to provide oxygen. Cats struggling to breathe often aren't getting enough oxygen into their bloodstream, and restoring that balance quickly can be life-saving. In veterinary medicine, there are several ways to do this. Oxygen cages create a calm, controlled environment, while masks can deliver oxygen directly. Once your cat is stabilized, the next steps depend on the specific diagnosis. For example, if the issue is an upper respiratory infection filled with congestion and mucus, your vet may prescribe antibiotics and recommend humidity therapy, something as simple as letting your cat sit in a steamy bathroom a couple of times a day to help clear the airways. If it's pneumonia, the focus shifts to strong antibiotics and supportive care. In cases involving trauma, internal bleeding, or tumors, more advanced treatments like surgery may be required. For cats diagnosed with asthma or bronchitis, which affect the lower airways, corticosteroids are commonly used to reduce inflammation and help the cat breathe more easily. Regardless of the exact condition, one message remains clear. If your cat is breathing heavily and not improving, it's a medical emergency. Cats are experts at hiding discomfort, so by the time symptoms become obvious, things may already be serious. Don't wait and see. Don't hope it resolves on its own. Call your vet or head to an emergency clinic as soon as possible. And remember, prevention plays a big role too. How to help your cat have a healthy respiratory tract. Taking care of your cat's respiratory health doesn't have to be complicated, but it does require some consistent habits. First, ensure they're on a regular deworming schedule. If your cat is already on a heartworm prevention plan, deworming is often included. Otherwise, make sure they're dewormed at least twice a year to reduce the risk of parasites that can affect their lungs. Another important step is minimizing their exposure to secondhand smoke and environmental pollutants. Cats have delicate respiratory systems, and even low levels of smoke or toxins in the air can lead to irritation or long-term damage. In addition to maintaining a clean air environment, don't underestimate the value of routine veterinary checkups. Seeing the vet at least once a year allows for early detection of any developing issues. If your cat tends to get frequent upper respiratory infections, speak with your veterinarian about ways to boost their immune system. Some cats may need extra support to stay healthy, especially if they've had recurring symptoms in the past. Keeping your cat indoors is another smart preventive step. If you do allow them outside, make sure it's only during supervised time or in a KDO, ensuring they're protected from potential exposure to infectious diseases or accidents. If you're not sure if your cat is at the right weight, ask your veterinarian. A quick and easy way to find out is to use the hand test. Weight management also plays a surprising role in how well your cat breathes. Excess body fat can put pressure on their chest and make breathing harder. If you're not sure if your cat is at the right weight, ask your veterinarian. A quick and easy way to find out is to use the hand test. Feel their ribs behind the front legs. If they feel like the back of your hand, their weight is just right. If they feel more like your palm, they may be overweight. And if they feel like your knuckles, they could be underweight. Have you ever noticed your cat breathing heavily or struggling to catch their breath? What turned out to be the cause, and how did you handle it? Share your story in the comments. It could help someone else going through the same thing. And if you found this information helpful, don't forget to hit that subscribe button. We've got more practical tips and vet-backed advice coming your way to help keep your furry friend healthy and happy.